Good morning. I'm Chris Thompson from the College of Nursing and Health Professions, and today I'm interviewing Melissa and Bailey from the Occupational Therapy Department at USI. And there's a lot of things that people don't know about occupational therapy. I think that the thing that we get hung up on is the word occupation. And occupational therapy encompasses more than just a person's job, right? I mean, in the definition of occupation in your profession as practitioners, what would you say that word means?
Well, occupation is not just a word referring to one's vocation. Instead, it's an umbrella term that is meant to cover the meaningful tasks of life that people perform every day. So, for example, in everyday living, I would get up in the morning, get ready, go to class, we'll go to work or go hang out with friends, and then hopefully that night we'll get to sleep and not pull an all-nighter. All of those things are occupations to me and to Bailey because those are things that are meaningful to us. Our lives would drastically change if for some reason we were unable to perform those tasks. So therefore, occupational therapy is the rehabilitation process that takes place that we carry out to help people be able to do those meaningful tasks that are so important to them.
So if I get ready in the morning and I brush my teeth and put on my eye makeup, you would help a person do even those
Absolutely.
types of things if that's what they wanted you to do. If that's what was important to them, as practitioners, that's something you would work on with them.
Absolutely.
I don't think people knew that. I think they assumed that it was something about getting back to work. That's fascinating. How do you enhance an individual's participation in their use the term meaningful occupation? How would you enhance their participation in that?
Well, an occupational therapist will evaluate the person's physical, psychological, and cognitive skills. They will also evaluate their environment and then the activities in which they perform. So they will sit down with them, figure out what they like to do, what they like to perform each day, and then they will work with them on those tasks from which they're lacking.
Okay, so you find out then, you would interview me or do an assessment to find out what my goals were. Say I had a stroke and I wanted to get back to being able to bake a cake
Yes.
for my family. That would be something, it doesn't seem like it would be an important task to other people, but to me it is. So you could help me do that.
Mm-hmm. Absolutely.
Yes.
Excellent, excellent. I don't think that's another thing that people knew much about. Do you use a lot of tools and equipment when you're working with people to try to rehab them back to what they previously could do?
Yes, some things that other professions will see us use often are things like assistive devices such as canes and walkers. We also are able to adjust wheelchairs to fit a client, basically. So you start with the person and then you adjust the height of the wheelchair, the wheels that are on it. You can tilt it, you can put cushions in it to prevent any skin breakdown, things like that. And then also you'll see us use gait belts a lot.
What's a gait belt?
A gait belt goes around the waist and it's just intended to have a handle in case someone falls. It's a safety precaution.
So that makes sense. So you can let them be a little more independent while still holding on to that gait belt.
Yes.
That's a good idea because I know so many people just want to be able to walk again sometimes.
Yes.
And that weakness is preventing them. So, getting back to the wheelchair, I think a lot of people think that you can just sit down in a wheelchair and that off you go. But not so much. It sounds like occupational therapy practitioners are part of the story there.
Yeah, we can actually fit and mold a wheelchair to fit that specific person. So it'll fit them and it'll be at their right height, their width, it'll fit them perfectly just for that specific person.
So if someone's in the hospital, say they suffered a stroke and they're going to go home with a wheelchair, would there be an occupational therapist involved with that?
Yes.
Typically?
Yes.
Yes.
Really interesting, really interesting. The educational requirements for an occupational therapist assistant and an occupational therapist must be rather rigorous then. You must need quite a bit of education. What kind of educational background do you have?
For the occupational therapist, you're required to get your master's degree.
Okay, so how many years would that be?
It's about 6 years.
6 years,
Yeah.
okay. And as an assistant?
Yes, as an occupational therapy assistant, we have to go to school for at least like 2.5 years is what it usually ends up being, and that is an associate's degree.
An associate's degree. And USI offers both of those
Yes.
programs,
Yes.
correct? What are the responsibilities between the two of you, and how do you work together? I know, with a 6-year degree and a 2.5-year degree, there's probably some differences in what you do, right?
Yes. The occupational therapist will evaluate the client and make up a treatment plan.
Mm-hmm.
Then the occupational therapy assistant will work with that client on the day-to-day activities, and then they will both work together on, revising the treatment plan, making sure the patient is getting the right care, and then they will work together to make sure that that patient is safe and they're getting the best care possible.
And making progress, I would
Yes.
imagine, too, towards
Yes.
whatever they want to be their goal.
Yes,
Yes.
the occupational therapist will.
They will adjust the goals, and they will work with the information that the occupational therapy assistant has gathered, and they will work together and increase those goals based on their patient's progress.
So you work closely together then?
Yes.
And both
Very.
work with the patient?
Yes.
And occupational therapy assistants are also able to help with evaluations.
Yeah.
We assist with them, but usually we do things that are called standardized evaluations.
Mm-hmm,
They have set answers or a specific number that goes with each of the questions.
Okay.
And then I would report to Bailey as the occupational therapist.
Mm-hmm.
And we would just work very closely in that evaluation process, and even during the treatment process.
Okay.
We collaborate closely.
Great, great. So it sounds like you see a lot of each other then.
Definitely.
All right, the professional organizations usually set standards for professions. Is there a professional organization that does that for practitioners like yourselves?
Yes. NBCOT
Yeah.
is the National Board for Credentialing of Occupational Therapists, and that is the board where we will sit for an examination, just like a nurse or other professions, and we will sit for our examination in order to receive national credentials to practice occupational therapy.
So you're nationally credentialed
Yes.
then? Okay, wonderful. But then I think that nurses are also licensed by the state and physicians. Is it the same for occupational therapy practitioners?
Yes, we are required to be licensed by the state.
Okay.
Yeah.
So the state that you work in, or once you're licensed in a state, are you licensed everywhere?
No.
It's just the
Yeah.
state that you work in.
Yeah.
So just like the other professions
Yes.
then. What are some of the places that we might run into you to?
A lot of places. We work in skilled nursing facilities, we work in mental health hospitals, we would go into community hospitals, any kind of therapy.
Any kind of therapy departments. We would work in schools. We can work with any type of population.
Okay.
We're there.
Which disciplines do you work with most often?
Occupational therapy practitioners, we work with nurses, we work with doctors, we work with teachers, we work with radiologists.
Wow.
We work with everything.
So pretty much everything. So you have to be able to communicate with all those people what you're doing with the patient
Yes.
and how far you've gotten so that their expectations of what that patient can do.
yeah.
Yes, and not
Or no.
only with professionals, but also paraprofessionals such as nurses' aides, because often they are responsible for assisting patients with baths every day,
Right.
or for assisting patients with mobility, and also for educating family members.
I was just going to ask about
Yes.
family members because I imagine there's a certain amount of assistance when a patient goes home that their family has to
Yes.
offer because you can't be there forever helping them with a shower or get ready every day. So the families also have to learn as well.
Yes.
That's a big part of it, I'll bet.
Yeah.
It
I'll
is.
bet. The last question I'd like to ask you is, what would you like to tell people about what you do as practitioners that you don't think that they know? What is the one single thing that you'd like to say that you think would surprise people?
Well, there are a lot of things that people don't know about us because our profession is so broad. One thing that comes to my mind is we fabricate and we make our own splints to fit our patient. So we get the pattern, we use the plastic, we heat it up, we mold it to fit our patient for whatever is wrong with them. So to mobilize their hand or to immobilize their hand to keep them from being hurt after that.
Okay, so if I broke my wrist, what might you do to help me? I'm right-handed. So what might you do with that splint? I mean, the doctor put a cast on it. So has the cast come off now when you put on that splint?
Yes, the cast will come off.
And you make a custom piece for me that's going to help me continue to heal
Yes.
so that I can regain use of my hand?
Yes.
Yes.
Excellent. Occupational therapists do a lot more than I thought.
Yeah.
Yes.
So this has been really informative. Thank you so much for joining me today, Melissa and Bailey. And if you have more questions about occupational therapy at USI or occupational therapy assistants, call the USI College of Nursing and Health Professions.